4 questions to ask medical staff that can help guide a conversation for navigating chronic illness, acute illness, and end-of-life care. 1. What is the exact diagnosis? Learn all you can about the illness or disease and how it will affect someone who suffers from it. 2. What is the natural prognosis of the condition without treatment? If you were to allow the illness-disease to advance, what would happen? Note, sometimes curative treatment might be more arduous than natural progression of the disease. 3. What are the treatment options for the illness or disease? What are the chances of success? Some treatments are more painful than others, and some may be worse than the actual illness or disease. 4. What are the potential complications of the treatment under consideration? These are the 4 questions that stand at the crossroads of life and illness and death that stir the very core of our being, challenging us to confront the inevitable with courage, grace, and wisdom. When a loved one faces a chronic, acute, or terminal illness, or when we ourselves are at that precipice, the clarity we seek is often shrouded in fear, uncertainty, and an overwhelming sense of loss. Understanding the exact diagnosis is not just a matter of knowing the name of a disease. It is about grasping the full scope of what lies ahead. It is the first step in a journey that may lead to acceptance or to a fight for more time. To truly learn about the disease, we must open ourselves to the truth, no matter how harsh it may be. This knowledge gives us the power to make informed decisions, to weigh our options with a clear mind, and to prepare ourselves and our loved ones for what is to come. But what does it mean to know the natural prognosis of a condition? It is to understand the trajectory of life without intervention, to acknowledge the potential, possible, and one day inevitability of the body's decline. For some, this knowledge brings peace, a surrender to the natural course of life. For others, it may ignite a desire to explore every possible treatment option, to grasp at every moment of life, no matter the cost. Yet, the truth is that not all treatments are a blessing. Some may be more arduous than the disease itself, stripping away the very quality of life we seek to preserve. This brings us to the heart of the matter: treatment options. The odds of success, the pain they may inflict, the side effects that may follow. Each option must be weighed not just for its potential to extend life, but also for its ability to enhance or diminish the quality of that life. It is here that we must ask ourselves, what is the form or quality of the life we seek to preserve? Is it one filled with joy, connection, and meaning, or one overshadowed by pain, isolation, and suffering? In these moments, we often confront the complications of treatment: physical, emotional, and spiritual. The body may endure, but what of the spirit? What of the mind, the heart, the very essence of the person we love? These are questions that go beyond medicine, touching the very soul of what it means to be human. And in these questions, we find not just the possibility of life, but the potential for healing. A healing that may not cure the body, but that can soothe the soul. Quality of life becomes a beacon in these conversations, guiding us through the darkness of fear and uncertainty. It challenges us to look beyond the mere extension of time, and to also consider the richness of that time. Relationships are often tested in these moments, as families struggle with the weight of decisions that no one should have to make. Yet, within these struggles, there is also the potential for profound connection, for a deepening of love and understanding that transcends the physical. When faced with these decisions, it is common to turn to maladaptive coping mechanisms, denial, avoidance, or anger, as we grapple with the enormity of the situation. We may try to hide our fears, even from ourselves, pretending that if we do not speak of the illness, disease, or potential death, then it will simply go away, not come. But these defenses often only serve to isolate us further, cutting us off from the very support we need. The ramifications of these decisions extend far beyond the individual. They affect families, marriages, even parenting. When a parent is consumed by the fight against an illness, the emotional and psychological toll can ripple out, affecting the quality of life of their children, the stability of their home, and the connections within the family. Yet, within these challenges, with openness and vulnerability, There are also opportunities for healing, not just of the body, but of relationships and the soul. By engaging in these difficult conversations, by asking the hard questions, we open the door to a more authentic experience of life, one that is grounded in truth and compassion. We create space for love, for connection, and for the kind of care that honors the dignity of the person, no matter the outcome. If, after all this, you find that the burden is too great, that the questions are too heavy to bear alone, consider exploring professional help. As a reminder, here are those 4 crucial questions again. 1. What is the exact diagnosis? Learn all you can about the disease and how it will affect someone who suffers from it. 2. What is the natural prognosis of the condition without treatment? If you were to allow the disease to advance, what would happen? Note, some curative treatment might be more arduous than natural progression of the disease. 3. What are the treatment options for the disease? What are the chances of success? Some treatments are more painful than others, and some may be worse than the actual disease. 4. What are the potential complications of the treatment under consideration? In the words of David Kessler, a renowned expert in grief and mourning, each person's grief journey is as unique as a fingerprint. But what everyone has in common is that no matter how they grieve, they share a need for their grief to be witnessed. That doesn't mean needing someone to try to lessen it or reframe it for them. The need is for someone to be fully present to the magnitude of their loss without trying to point out the silver lining. Let this be your guiding light as you navigate the profound journey of chronic illness, acute illness, and end-of-life care, finding within it the opportunity for healing, for connection, and for a life lived with dignity and grace.